Hey, I'm David, your pharmacist today. Here, I'll show you behind the scenes of outpatient department. So, let's go. Okay, after receiving the prescription from patient, the pharmacist in charge will do the screening. Basically, we will check if there any medication error or uncertainty on the prescription. We will also ask if patient was able to collect their monthly medication supply at our facility. If not, no problem. We have VAS. Pharmacy Value Added Services, VAS, directory is a system made for patients' convenience. VAS is divided into three, SPUB, DT, and UMP. SPUB, System Pen Dispensing Ubatubatin Bersepadu, is a system which patients can get their monthly medication supply at their nearby KKM facilities. This is the process of registering the prescription into the SPUB system where pharmacist assistant need to fill the SPUB form manually. Then, the registered SPUB form will be transferred into Pharmacy Information System, PHIS, that is synchronized with all government healthcare facilities in Malaysia. Here is an example of SPUB form. While DT is a drive-through method which patients can get their medications without dropping off from their vehicles, just like McDonald's. This is DT form in HSNI. While UMP or Ubat Melalui Pass is a service which the medications will be posted directly to their address. This is the UMP form used in HSNI. The registered DT and UMP form will also be transferred into Pharmacy Information System, PHIS, before filling the medication. Then, the filling will be done by pharmacist technician, which is you guys. If there any error in the prescription like dosage or out-of-stock medication, we need to reconfirm with the prescriber whether to omit or change the dose of medication. Upon filling the medication, pharmacist assistant may need to fill dangerous drugs, DD. But wait, pharmacist assistant is not allowed to fill or dispense any dangerous drug. But pharmacist will do. The prescription will come along with DD form. No DD form means no medication. This is the DD room where all dangerous drugs are stored securely. Here, everything needs to be handled by pharmacist. Some of the medication, especially for pediatrics, needed to extempore on our own, like syrup or suspension. So, here is an example of extemporaneous preparation of Ursofox suspension. Here is the example of preparing syrup propranolol. To do the extemporaneous preparation of syrup propranolol, you need to add the amount of tablet needed into the mortar. Then, crush it till becoming fine powder. Like this. Add a little amount of syrup, which in this video we use extemp, then triturate it until it become fully dispersed. In this video, it may not look like it is fully dissolved, but over time, it will dissolve. Pour the solution into the amber plastic bottle. Next, wash the mortar and pestle repeatedly with extemp until it cleaned. Then, make up to the final volume. And shake the bottle vigorously. And lastly, label and send it to pharmacist for final checkup. Next, after filling the prescription, pharmacist technician will put the basket full of medications on a counter. This is where the pharmacist will transcribe the prescription. Then labeling will be done here. The basket will be sent back to the front and will be dispensed by a pharmacist. Quick tips: the pharmacist needs to dispense the medications to patients along with appropriate counseling and reminder. Always stay positive and try to create a good connection with patients. So, I guess that's it, the workflow in outpatient department. See you next time.
Hello everyone, here we would like to share a few tips on how to survive during hospital training. First of all, you need to get ready with pen and notebook. This is the pen I'm referring to, the 4 color in one pen. When you are going to write on any intervention or correction, you will need to use the red color. And then when you are going to record the temperature in the facility, you will need to use the blue and the green ones. And then the black color is for usual use. This is my notebook. The pocket size notebook that can fit in my pocket, and I can bring it everywhere, so I can write things on the go. Make sure that you write almost everything that comes from your pharmacist or pharmacist assistant, especially things that you are seems to not familiar with, so you can remember it later. These are my notes. I write the brand name and the generic name of drugs available in the facility. I also write about the workflow inside the facility. And after I come back home, I will reorganize my notes into this. This is the reorganized or the simplified notes that I separate for each department. As an example, this is for the logistic pharmacy. So when I need to revise on the logistic pharmacy, will go for this, and if I need to revise for outpatient pharmacy, then I go for the other notes.
Next, we must read through and understand the logbook for each department, especially the assessment part. This is because to ensure that we know the do's and don'ts in each department during our hospital training. Besides, we will also know the responsibility of pharmacist assistant in every department. So, make sure finish the logbook before having hospital training in each department. I think by doing this, we will not waste our precious time by doing nothing, or yet we will feel bored. So, enjoy!
Last but not least, always ask the staff. If you don't understand, they will not be mad at you. But if you make mistake, just wait and see. And I suggest you to download Blue Books apps. It will really help you to know the brand name and generic name, as doctor will use a brand name for certain medicine.
The most important tips I want to share is always stay positive and believe in yourself in every situation that you faced. You may face some difficulties and messed up a little bit, but it is okay. Don't let those thoughts and other people's perceptions affect your performance throughout the practicals. And if you guys have any questions or something you want to ask us, make sure you guys comment down below, and we'll make sure we will reply to you guys as soon as possible. So
That's all from us. Good luck to all our juniors that will be practical soon. This will be a great experience for you guys. Okay, that's all. Bye.